Hi, Dr. Mike Smith from The Biting Edge. This week's MLS laser tip. Now, there's a lot of patients that come in that have a lingering pain. That lingering pain comes from a temporal tendonitis. So let's look to see what we can do to treat temporal tendonitis with the MLS laser. Now, there's several ways that we go ahead and do that. We can go from the outside on the coronoid process. Just try and turn your head a little bit away, where we have the insertion of the temporal tendon in the coronoid process right in through here. And this is a very common area that we go to laser because this is an area that continues to be in spasm in that insertion. So what we like to do is we like to get and identify where that pain is coming from. Now open for me, and you can feel where that flexes and she goes to close and close. And where we're going to be shooting is right here at this angle, right at the underneath the zygoma at the tendon insertion. And we're set our laser to 900 hertz, 3 minutes at 50%. And we identify it, and we go ahead and we get our laser head right on that area, and we shoot that area for 3 minutes in a static environment. Now, if the patient still has some degree of discomfort and pain back on that temporal tendon, we can also go in with our intraoral tip. Now turn a little bit here and open for me. And what we're going to do is we're going to retract her back, and we'll identify where that temporal tendon head is on the coronoid process with our finger. And that's right where we take the intraoral tip in to treat that spot in the mouth. And we come back in, and we can get right up on that temporal tendon head, angling it back and superior to get into that insertion on the coronoid process. And we treat that again for 900 hertz, 3 minutes at 50%. This week's laser tip. Hopefully everything goes great and get your patients out of pain. Dr. Mike.